All right. Good morning, everybody. Good morning, everybody. Thank you all for being here on this beautiful Thursday. Spring is officially here, so I'm sure everybody's allergies are all, up and roaring. So I hope they're not too bad for you, and that you can enjoy the flowers a bit. Before we get started with today's agenda, I would love if everybody could introduce themselves, and we'll start with the folks in the room. So I'm going to popcorn it to Elena.
Hi, I'm Elena Martin. I am Housing Case Manager at Tri-County Community Action Agency, and I'm also on the leadership of the coalition.
Stephen Wilson, prior leadership team member, member of the recovery community.
I'm Catherine Maloney, Tri-County Community Action Agency. I'm the Chief Financial Officer there, past leadership team, and happy to be here.
Dennis Daniels, Vets on a Roll and American Legion Post 45. We work predominantly with disabled veterans, getting them out in the lake. And then we also do families with special needs.
Oh, and I'm Keenan Tyner Smith. Sorry, I'm Keenan Tyner Smith. I'm the Director of Prevention here at Southside Behavioral Health.
And our fiscal agent.
And our fiscal agent for Southside Wellness Coalition. All right. Happy to be here.
Get that.
All right, Leo, I'm going to popcorn back to you.
Okay. Well, good morning, everybody. Hi, y'all. I'm Liam Hudson. My pronouns are he, him. I am the co-founder and CEO of the Lean In Project, and I have the honor and privilege of serving as the chair of the Wellness Coalition and hanging out with all of these fun folks. And so excited to be here with you all. Thank you for joining us today, and I'm going to popcorn it to Allison.
Hey everybody, I'm Allison Byrne. I am the Community Engagement and Partnerships Coordinator at the Richmond VA, and I'll be talking more at you in a little bit, so I'll save the rest for later. Thanks for having me. Now popcorn to Barbara.
Good morning. I'm Barbara Johnson, and I'm a community health worker with the Virginia Department of Health, and we serve Mecklenburg, Halifax, and Brunswick counties. And I'm due to Kira.
Good morning. I'm Takira Lewis, the Senior Reentry Probation Officer at District 8. We cover Lunenburg, Halifax, and South Boston area. And I'm going to go to Ms. Simpson.
Thank you. I'm Shannon Simpson. I am the Southside COPE, which is Cooperative Opioid Prevention Education person for all of Southside for Virginia Tech. And I'm going to popcorn to Carla.
Hi, everybody. I'm Carla Thomas. I am one of the directors at Health Quality Innovators, and we are a healthcare consulting company in Richmond area, but we serve as the Medicare contracted quality improvement organization for the state. And we support local community collaborations and coalitions to improve health, especially health for Medicare beneficiaries. So we're working on a lot of the same topics that your coalition is addressing. So happy to be here and support the conversation. I will send it to Kayla. Did Kayla go?
Morning. My name is Kayla Gowen. I am an office manager with Groups Recover Together. We do medicated assistant treatment for opioid use disorder. I'm actually in Martinsville, Virginia, but we cover the entire state with offices. I think we have 11 offices right now. We do everything telehealth. So if you have any patients that are having transportation issues, send them our way. Happy to be here. Thanks for having me. Oh, I'm supposed to say who I'm popcorn to. Sorry. Laura.
Hey, I'm Laura Ghazi. I am the Business Development Relations Specialist with the Life Center of Galax in Hillsville. We offer detox, residential, and partial hospitalization programs for substance abuse. And I am driving and on my phone, so I cannot see who else is on here to popcorn it to somebody.
That's all right, Laura. I got you. Thank you. I'll popcorn it to Darren, please.
Thanks, Liam.
Right. My name is Darren Adams. I'm the Substance Abuse and Behavioral Health Outpatient Director for Southside Behavioral Health. I guess I was the last in the list, right? Everybody else went?
I think so. Yeah.
Right.
Save the best for last.
Shelley.
Oh, Shelley. I lied.
Oh,
We really
Shelley.
did save the
Okay.
best for
I'm
last.
sorry. All right. Shelley.
Good morning. My name is Shelley Clary. I'm the education specialist at the Virginia Poison Center at VCU Health.
Shelley.
Yeah. Thank y'all for being here today.
Didn't play fight this weekend. Can I jump in, Liam, real quick? For those of you, you want to share information as you just did with your introduction on the Zoom, if you wouldn't mind dropping anything you want to be in the minutes to be shared with everybody into the chat box today. That just helps me a great deal because I save the chat at the end of the meeting, so I'm able to make sure I've got everything right about what you wanted to share with all of membership. So thank you so much. If you could take a minute or two to do that before the meeting is over.
Yes, thank you, Keenan. And I'll add to that, just, we really value y'all and the work that y'all are doing in the community and know that y'all are the folks on the ground and seeing what's going on. So just want to say we welcome you to come on and present and share more about what you do at any of our coalition meetings. We're always happy to save some time on the agenda for 15 to 20-minute presentations if you want to share out that way. So just throwing that out there. If anybody's interested, you can feel free to reach out to me or Keenan, and we can get y'all on the agenda coming up. So with that being said, I think we need to review our minutes from our March 21st meeting. So.
Alrighty. All right, I'm sharing the screen.
Okay, and then the folks in person should have a hard copy.
They do.
Okay.
The minutes are, the recorded session is posted in the blog that went out with the newsletter that went out Monday of this week. We do have an active chimp mail that rolls over every 30 days to Foxglove Marketing. So if anytime you ever, I just mentioned the newsletter and you do not receive it, please let me know by email, phone call. I'm always checking with Alan from Foxglove to make sure our chimp mail is active, updated. Once you don't click it for a number of months, or if you don't subscribe, if you unsubscribe to it accidentally, it will not kick you back in. Even though I might add you after a coalition meeting, which I do every time. It links out duplicates, but I do need your help if for some reason you're not getting it. So I can individually ask her to check and make sure you're getting it. With that being said, any questions about the minutes? Guest speaker last month, Dr. Jackie Barnett. Updates, member updates. Any changes, suggestions, modifications?
Hearing no requests for changes or modifications, may I call for a motion to approve?
None here in the room. Yeah. Okay.
Motion to approve the minutes from the March 2024 meeting.
A second. Elena. Okay, motion.
Thank you all. Okay. Well, moving right along, we have a really exciting presentation for you all today. As many of you know, we were able to partner with the VA and Dennis and the wonderful folks at the Clarksville VFW to conduct a veterans needs assessment to understand a little bit more about some of the challenges and barriers that our veterans are facing, but as well as, some of the strengths that our community has to offer our veterans and some of the supports we have. And so with us today, we have Allison Byrne, who's gonna talk you through the needs assessment and share out the results. So turning it over to you.
Thank you. I am going to go ahead and share my screen. I'm going to turn my camera off just to like try to preserve the bandwidth on the weird VA system. One moment.
You can forward from these results, may I have a paper copy or just send me a copy so I can make sure I put it, and I will also send it to a number of our groups.
Can you guys see that okay?
We can, yes.
Okay, perfect. All righty. So yeah, like I said, my name's Allison Byrne. I am the Community Engagement and Partnerships Coordinator, and so I work as part of the suicide prevention team at the Central Virginia VA Medical Center, and I am lucky enough to be able to do coalition work. So I'm in the communities everywhere from Richmond all the way down to Southside, just partnering with people in different communities that are already doing great prevention work. So I really am excited to be able to share the results of our needs assessment with you all. And of course, thank you all that helped plan, that attended, that shared to get the turnout out. It was really great. So really quickly, I'm just going to run through some of the results and the themes from the SWOT analysis. And SWOT stands for strengths, weaknesses, opportunities, and threats. And then we'll talk a little bit about, we did a coalition meeting survey at the end of the meeting just to kind of take the temperature of those that did attend. And we'll talk a little bit about how the data that we got from the SWOT analysis can help inform our action planning. And I will show you guys briefly a couple of tools that other coalitions have found to be useful in terms of thinking about next steps in action planning. All right, so we had a really, really, really good turnout. Again, thank you all to everyone who participated or got other people to come. We had 38 in-person attendees at our SWOT analysis. It was on the 29th of February, I believe. And we focused on service members, veterans, and their family members, that population in Southside. So we reviewed the strengths, weaknesses, opportunities, and threats, and altogether we had nearly 200 submissions from the 38 attendees. So when we were asking about these different categories, we asked people to write down sort of what their take was, and we got a lot of really good data. So myself and my counterpart, Angela, we sort of went through all of this data and tried to identify some higher level themes. So the kind of bigger takeaways from the entire SWOT analysis that we saw were that community members that participated stated that there were challenges in accessing services, and that those could be logistical challenges, those could be the lack of having specialized services in the area, and even some kind of cultural taboos or stigmas around mental health, around substance abuse, and maybe lack of education around military culture. One of the other overall themes that we identified is that local organizations that support veterans are in the community, the VFW, DAV, et cetera, but a lot of residents don't know about the services that are available to them or don't know how to, engage with them to start utilizing them. And so we just saw opportunities for increased outreach, trying to identify the areas in which our SMVF population lives, works, and thrives, and how do we kind of get the message out to them and connect with them in those areas. So breaking it down kind of category by category, and I can definitely send these slides out, so don't feel like you have to take all the notes, right away. And I also have a document with all of the individual feedback on there. So if you wanted to look through kind of the raw data, and you might find themes that maybe I didn't identify, which is great. So high level strengths, we do have that support from VSOs. We have support from community organizations for veterans. there's a feeling that the community itself values veterans. Some of the feedback that we got talked about public events in which veterans were acknowledged, asked to stand, and people would honor them for their service. And that there are recreational opportunities as well for veterans and their family members too. The availability of healthcare was another strength that was identified. So having the VA medical centers in Durham and Richmond that people are able to go to if they need, and then having local healthcare providers in the communities as well. In terms of weaknesses, one of the big themes, and you'll see these on the next few slides too, transportation, that lack of transportation resources. Although you do have the 2 VAs that are within driving distance of Southside, it can be really difficult, if you don't have your own private vehicle. There's a lack of free or low cost public transportation options that is sometimes a barrier that keeps people from accessing care. There are limited services available in the area is another kind of weakness that was identified. So maybe not having as many options for specialized healthcare services and just other access issues that might occur. And a need for increased education and communication about those available services. So for the services that are in the communities, how are we letting people know that they're there, and how are we encouraging people to reach out to the providers? As far as threats, lack of funding was a big one, and that is very real. As we all know, budgets are real things, unfortunately, not monopoly money, right? And so how big our budget is does have a very large impact on the services that we're able to provide. That lack of transportation access again came through in the threat category, lack of awareness of services again, and stigma specifically around substance abuse, mental health treatment. That was another theme that we picked up, and that stigma might prevent people from accessing services or engaging in care. And then as far as opportunities, kind of switch the T and the O so that we don't end on a bummer. More groups for veterans is something that there was a desire from the participants. So they mentioned support groups, social groups, just opportunities for veterans to engage with one another in group settings. Expansions of outreach events for veterans. So again, trying to identify those places where we can identify veterans, service members and their families, and kind of see what they want to do as far as outreach and engaging in their communities. Increasing the awareness of existing resources that are in the community. Veteran employment was another theme that people really wanted to focus on, maybe the identification of business owners that are interested in hiring veterans, or even like a job board for veterans. Transportation assistance as well comes back in as an opportunity. Somebody suggested maybe having a network of people that might be available to give rides to service members, veterans, and their families if they're needing to access healthcare, something like that. So all of I put in the notes all of the feedback that we got, so you guys can definitely read over them if you'd like to in the future. But these are just some of the main themes that we saw. Any comments, questions about the themes? Other feedback?
Allison, this is Dennis Daniels. I
Hey.
really want to thank you for what you've done. This gives us, particularly through the opportunities, the weaknesses, areas that we can now with our local community start working and see what we can do in reaching out to our own networks in putting together to help reduce some of our weaknesses and increase opportunities. So I greatly appreciate it. Thank you so much for what y'all are doing. And whenever you're ready to start reaching out more to Durham, we have already organizations and stuff for you to do the same thing if you get a hold of your counterpart in Durham.
Oh yeah, that's awesome. Thank you so much. That is really great. And I'm glad that this data is helpful you know, even outside of Southside Wellness, right, for other organizations too. I think that's a really good point, because surveying the landscape can help not just this organization, but other organizations that are in the area. And I will definitely get my Durham counterpart to reach out to you as well.
Thank you.
No problem.
This is Catherine.
Hey.
How are you doing?
Good. How are you?
Good. I like what you've got up here, and I really do see, like Dennis touched on, that last bullet there, transportation assistant.
Mhm.
That is across this whole area.
Yes.
It's not just
Everybody.
Southside Wellness Coalition, it's not just veterans, it's not just Tri-County or Southside Behavioral Health or Centera. It's across the board. So many people have that issue that if all these groups can come together to solve that one issue, I think we've got not an easy win, but we've got a win for the community.
Yeah. And transportation is huge. I mean, you guys see it showed up pretty much every, every category that we evaluated. And you're right, it's not just a veteran population issue, because I mean, veterans that live in the community are also community members. And so if there is a lack of funding or lack of resources for that transportation, it's going to affect everyone. And we do know, I'll show you in a couple more slides, like the veteran population in your area, but only about half of them get their healthcare at a VA. And so transportation might kind of play into why many veterans choose to get their healthcare in the community, and that's totally okay too. But it can be a barrier at whether they're trying to get to a VA or whether they're trying to get to a community provider. So it is something that I think you're right affects pretty much everyone in the community.
Allison, I'm curious because along this discussion, you had mentioned earlier that you said that there were 2 VA centers that were in reach of Clarksville. I'm curious which 2 you were referring to.
Richmond and Durham.
Richmond, Durham, and we also have a fairly large clinic in Danville.
Yep.
Okay.
So it's great.
It is 3.
So in terms of the transportation issue that we're talking about, like how long would it take to drive to those centers from Clarksville?
Over an hour.
Yep, about an hour and a half to eat any of the individuals.
Okay. So if we've got transportation issues, they might as well be 100 miles away, because an hour is going to be a problem to try to get to.
Yes, they are.
Yeah. For Clarksville, Durham's probably closer.
We have that issue with everything.
No, we do. That's what, that's the whole comment, Stephen, was we have that issue with anything,
It
like
doesn't
our
matter.
clients, your clients,
And it
veterans.
doesn't matter if it's veterans, families with special needs.
No, it's
It's
exactly.
universal.
Somebody go to treatment, they go through the same thing.
Yes.
There's nothing, we don't have the infrastructure here. And
Right.
I'm complaining about this through Virginia Tech studies with other things.
Yes. Yeah, they have to go outside to get the specialized needs taken care of.
Yep.
Allison, I know you probably don't have the answer or the solution to this, but do you know what the process would be? Like, I know some VA localities do regional shuttles. Do you know if there's a process to petition for one in our area, or if we could do something like that?
That is a great question. So I know that the DAV used to do a regional shuttle at least like to Richmond. I am not sure what their process is, but I could definitely reach out and try to see if there is one, and at least, get you guys an outline of what that might be. Yeah, that's definitely something I can follow up on.
Great, thank you.
No problem.
The shuttle would be a fantastic idea. Alternatively, what about just being able to, open up, make TRICARE more accessible for, some of the service providers that are in the area that are next to where the veterans are.
Yeah, that would be wonderful. I know that many veterans don't have TRICARE, but I think especially for like service members and family members, that would be a really, really great opportunity for them to, because they are generally more likely to have TRICARE. Some veterans have TRICARE for life, some don't. But yeah, I think that that's also a really great idea.
Another thing to potentially address is that I believe, I don't know about Mecklenburg County and Halifax County, only one pharmacy accepts TRICARE, and that's Walgreens.
Oh,
That's the big problem.
yeah.
It's not universally accepted like
Correct.
Blue Cross Blue Shield is or whatever.
Right.
I mean, we personally, we have TRICARE for life, and we went through the same thing. When TRICARE declined in renewing our local pharmacy, and it took another 9 months before they were added back into the TRICARE system. So that's, it's very, I would say, for us, it's no big deal, but for a lot of families, that is a huge issue.
Yeah, absolutely.
When you're used to your doctors and everybody going to a specific pharmacy, and all of a sudden now that pharmacy is dropped out of the system.
For
And
sure.
I'm sure it's a scramble.
Right.
But that's not just veterans now. Again, you've got to look at that. That is for any family with special needs. It depends on, because they lose their drugs, they lose their pharmacies because either the pharmacy decides or the drug company decides. So these are kinds of things that as a coalition, we need to look at in the broader perspective, because it's becoming more and more prevalent as insurance companies and others. So how do we provide a safety net for our community is what I'm looking at. It's a broader issue, just like the transportation.
I have a question with that. Do things like TRICARE support prescriptions by mail, like express scripts and things like that?
Yes.
They do, but there's some prescription, like for example, my child has TRICARE, he does in the military, he takes medication that we can only get locally. None of the pharmacies have it right now, so he's doing without his medication.
Yeah.
And I would have to pay out of
some
pocket.
medications
Yeah.
issues with supply chain stuff, and
Yeah.
that was
Right.
that was a problem. Okay.
Yeah,
So
and when you're combining that with transportation issues too, like that's a really good point. If you're going to one pharmacy and you can get to that pharmacy somewhat reliably, and then for some reason the insurance is not willing to work with them or they don't have the medication in stock, then that becomes another kind of layer. How do I get there? Even if you can locate somewhere that does have the medication. So it's definitely a lot of these concerns are systemic. Y'all are right. Like it's not just something that affects veterans. It's not just something that affects, one subset or another subset of the population. They're systemic and they sort of interact with one another to create these potential barriers to care that, have an effect on our whole community.
It may not affect, or it may affect more than one subset, but the difference is if it affects me, I can create a workaround. And a lot of these veterans cannot.
Right.
I pay out of pocket when Walgreens doesn't have my child's prescription, but that's not an option for a lot of people.
Absolutely. Yeah.
That's
right. When you're, correct.
And again, this is great because what you have basically identified, it's although we're talking about a subset, it is applicable across our entire co-op.
Correct.
Maybe slightly different, slightly more or less here, but every single one of these, you can think about any of our existing groups. And almost all of these apply to one extent or the other.
Right.
So just trying to solve for any of them.
The problem is exacerbated by
Yes.
circumstances.
And how you solve might be slightly different between these subgroups, but the overarching resolution may be very similar.
Correct.
With a little tweak here and a little tweak there.
So it's not, from my own perspective, it's not to just support one group, but look at how do we make this more inclusive versus, in other words, we don't want to solve just the transportation assistance for vets. We need to figure out how we can put together transportation assistance that helps provide the broadest service possible
Right.
to the broadest amount of people. In fact, I mean, it may be something as simple as Monday, the transportation is, and work them out with the organizations. Monday's Vets Day, so we have shuttles to both VAs, and the VAs would have to support us. Tuesday is transportation for the following subset to these organizations. So we can get them to Richmond or Durham or wherever they need to go. But that way, if we have a small subset of transportation available, we can divide it up amongst the groups so that everybody gets taken care of.
Right, and the thing is, if you look at opportunities, to find funding for some of this stuff, you might be able to start with veterans and find funding for veterans, and then people can come along for the ride,
Or
so to
use the
speak,
infrastructure.
or the other way around.
Right.
So I mean, I think there's options, but I think you're right. You just can't tackle it for one segment of the population, but you might have to start there.
Right, however we
okay.
do it. But
Right.
that's the reason
Yeah.
why we're together as a group, because we then can tackle whatever resources and stuff we have access to. And we use this to piggyback to help all versus just our own niche.
Right.
Definitely. Definitely. I really appreciate the discussion around this, y'all. That's, that's what this is kind of made to do, to sort of like act as talking points, jumping off points. First, we have to identify, what the opportunities are, what the threats are, what the weaknesses are. And then from there, we can kind of move forward and an action plan. I'm going to move on just to touch briefly on the coalition meeting survey that we did. So that was the survey where we asked all 38 people to that attended, kind of what their thoughts were on the activity, if they felt like it was a good use of their time, if they felt like the needs assessment aligned with coalition's goals. You can see all the questions there. Also an opportunity for recruitment. We asked people if they wanted to be alerted to the next meeting, if they'd like to be invited, they could share their email. So I made a little graph, and it's a little the blues that you're seeing are strongly agree. There are no strongly disagrees on this. It looks a little wonky when you're looking at the key, but you can overall see that we had 19 participants that completed that survey, and so 9 of those 19 that completed stated that they wanted to attend future coalition meetings. So that's really great. Hopefully we'll get a good turnout and some new people in. Most people had a pretty positive perception of how they felt the meeting went. So most people, agreed with most of the questions that we asked. The coalition listened to what you had to say, feeling engaged in the meeting, feeling like they got what they intended, feeling like it was a good use of their time. So those are kind of the results of our survey, and that's definitely something. If you all want to do like more surveys in the future when you're having these types of events, I'm happy to help, kind of design and tweak and support with that effort as needed. But just wanted to share that perception. So looking at action planning, so we've sort of defined the problem, and we know statewide that the problem of veteran suicide is big. It's 27.5 per 100,000 people. And so when we're talking about all of these systemic concerns and all of these risk factors that might be present in the community, these are all things that do impact suicide rates. Our target population is the service members, veterans, and families that do live in Southside, and just keeping in mind our mission, collaborating with local resources and partnerships to foster wellness and a drug-free community for our youth, adults, and families in the counties of Brunswick, Halifax, and Mecklenburg. So next, I am going to share a little bit about action planning. We have a couple of tools that some of our other coalition members have found to be helpful. This is the action planning guide. So what we have here is the state data sheet, which it's coming, gives us a little bit of information about veteran suicide in Virginia. They come out with one of these every year. And we can see that after accounting for age differences, the veteran suicide rate in Virginia is significantly lower than the national veteran suicide rate, but it's still significantly higher than the national general population suicide rate. There's information about comparing Virginia suicides to the national rate, to the rest of the southern region, and then information about means used here. So just kind of more background information for you all to review. The community profile for Southside. So we've got data on all of the active duty, reserve, guard, and veterans that are in each of the 3 counties. So altogether, you'll see that the veteran population is just over 5,800, pretty large, and about half of those are currently enrolled with the VA Healthcare Center. Others might be engaged with like VA benefits, but we just have data on who's enrolled with healthcare.
And if you'll look, it's the 65 to 74-year-old people.
Oh, yeah.
The age.
Largest population in Mecklenburg is 65 to 75.
And 75 plus.
Yeah, 75 plus in Mecklenburg. And then, sorry, I'm having to scroll, but yeah, Brunswick County, it's 26% of the veterans are 35 to 54. And then in Halifax, 31% or 65 to 74. So a pretty big difference there between those 2 counties. So all things to kind of keep in mind when we're thinking about how to get our message out there, how to outreach to different, segments of the veteran population, because age groups might affect where people are going, where they're spending a lot of their time. So
the inability for some of these older veterans to drive in Mecklenburg County when 70% are 64 and older.
Right. That's a really good point. Yeah.
That was Dennis's point.
Hey,
That's
when
a
I'm
really good.
one of the young guys, that's when you start to get worried. Trust me, being 70 and being the young guy for half of these things, really, that's what I mean. It's a huge highlight for what some of the issues are we have around here.
Yeah, definitely. So going back, I also attached like all of the feedback that we got from the needs assessment. So all of the strengths submissions, all of the weaknesses. So if you guys want to read that, had a little fun with color coding it as well. And then, so we'll move on to the action plan. And so when we're thinking about goals, I'm sure you guys are probably familiar with the term of SMART goals. So goals that are specific, that are measurable, action oriented, relevant, and time bound. That's really what we want to be focusing on when we're talking about our action plan. And so we have an action plan document that you guys are free to use or adapt however you think it might work best for you. We have our action plan tabs organized in terms of priority area. So the VA priority areas, as far as our community-based suicide prevention interventions, are identifying service members, veterans, their families, and then screening for suicide risk. Priority area 2 is promoting connectedness and improving care transition. So I put a little example here so you can kind of see how you might use this sheet when you're thinking about a specific goal or strategy that you want to implement. You can pick, what the focus area is. I said promoting connectedness, and the kind of example I was using was an SMVF resource fair. So description of what you're doing, any action items that you might need to complete to implement this program or policy. So contacting agencies to inform them of the event, encouraging participation, flyering at the VFW, etc. Right? Quantifying that. So what's your goal? How many people do you want to attend? How many people do you want to participate? When do you want to have the event? And then looking at your outcome measures. How will you know that you've met your goal? How will you know that you've done what you wanted to do. So you could say, I want X amount of attendees and like a certain proportion of them to be service members, veterans, families, um, and people that care for them. Resources, who's responsible, when to review, but using a sheet like this can be really helpful in terms of planning. And then you'll see in the red that there's that sustainability planning portion. So when you're looking at sustainability planning for action items and annual reviews, you might say, do we want to do this SMVF resource fair every year, right? How sustainable is this? What kind of manpower are we going to need to pull this off? So it can kind of help with keeping all of the different things that you all are working on as a coalition, and they're all like really, really great and really important things. It can kind of help to have one sheet where you're able to quickly look at where you are with implementation of all of your ideas. And of course, you can edit this, you can, make it work for you, but that is just an example. And a couple other things. So the coalition sector wheel is this document, and it really kind of helps coalitions focus on landscape. So we want to make sure that our coalition is reflecting the diversity that is part of your community. So looking at, do you have representation from these different groups? If there's a group that's not here, how can we get them to the table? So other coalitions, I'm sorry.
No questions.
Oh, sorry. I thought I heard something. Might have been my cat. But just looking at who we can bring to the table, who's already here. Other coalitions have sent this out and had individuals, mark sort of where they feel like they fit on the sector wheel. And so then you can see maybe what areas are left out and where we might need to do some more recruitment. And then the last tool I wanted to show you all is the strategy selection tool. So just helps us map when we're thinking about strategies, we're thinking about feasibility and impact. So what do we have the resources to do right now reasonably, right? What's like maybe a stretch, and then what are we like, we definitely don't have the resources to do right now. And then impact. So how big is that footprint going to be? Going back to the example of the transportation, if we're able to like broaden some kind of transportation program so that it affects, more than just veterans, that's going to be a really, really high impact activity, right? But do we have the feasibility to do a broad-based kind of public transportation program or project right away? That might not be super feasible, but it might be maybe mid-level feasibility to focus it on veterans at first and then expand it. So just kind of helping with conceptualization of where might be a good place to start, what might be a reach, and for those things that are a reach, how can we plan around it so that we're able to, make that stretch in the future. So that's pretty much what I had. That was my presentation. Do you guys have any more questions or comments or anything that I can, any discussion? I can stop sharing too.
Allison, are you in Richmond?
I am.
Keyshawn Simmons is our point of contacts for the veterans fishing trips there in the Richmond VA.
Okay.
He's the one that brings the buses down.
Oh, cool. Okay.
So make sure you touch base with him. We would love to invite you to one of the events.
I would
The
love that.
Next one will be June 19th, weather permitting.
That's great. Do you have their email?
Yes, I email them routinely, and that's how we do our coordination, both email and via phone.
Okay. Perfect. I'm gonna I'm gonna email you after this chat or after this meeting, if that works, and we can kind of coordinate that way. Does that work for you?
Perfect, and the same thing, your counterpart in Durham, I will set up with Tiffany Johnson, who is our representative at the Durham VA.
Okay.
And I can also I'm not sure who y'all have that works with Danville, but we can set you up with our community involvement and engagement person there.
Awesome. Okay. Yeah, I have a counterpart in Salem, so I think that's who would be working with Danville. So
Part of the Roanoke Salem VA system.
yep.
That was one of their clinics.
Thank you so much.
No, we will. In our conversations, don't want to take everybody's time here, but we will get involved to where you can catch a number of these veterans at one time at one of our, because we have Oxford, Granville, we have other veterans that are now attending from North Carolina also.
That's great. That would be wonderful. Again, like big impact, right? The ability to make a big impact. And I know that you all, working with all of your different organizations have the ability to have a lot of reach. And so I hope that this information can help with planning and really like visualizing, what the next steps are, kind of how to make that impact.
Certainly will. Thank you very much. And for the Legion and the VFW, we will also extend these to our district meetings, and those are included. So this will definitely expand just beyond Southside, Virginia.
Awesome. Well, thank you guys. Thank you guys so much. And if you, any questions or any like feedback that comes up, I don't know if would the easiest way to disseminate the slides be to send them to Keenan or Liam or okay.
Yeah, you send them to me, just any of the items that you shared that you want me to send, we can post them on the coalition page as part of the, next to the recording. Then if anybody wants me to then that will be in the next newsletter, they'll link to that. And then anybody that wants me to individually email them to me, if you'll just drop it in the chat or email me directly, let me know that you want me to send you some direct copies, I can do that. If not, I'm gonna put them up with the blog and the recorded meeting today and a link to the newsletter.
Awesome. Thank you all so much.
Thank you.
Thanks, Allison.
Thank you, Allison. Great work, Allison. That you really nailed that one home. Thank you for all your hard work on that and providing us with so many materials that we can use and move forward and like inform our practices with. So truly, thank you so much for all your work.
It's my pleasure. You guys have been awesome to work with. Look forward to the future.
Us too.
All right, next item on the agenda. Liam, do you have the agenda on your end? Do you need me to share it?
I do. I can share it.
Okay.
Well, so the next item on the agenda is the update from the leadership team. So our big update, I'll wait till that later. So the big update is that somebody talking, I'm sorry.
No, you go first on the team and then anybody else wants to follow you, it's fine.
Okay. So we were looking into funding from Centera. We decided to table that until the fall application round in hopes that it would help us qualify for more funding than we would be able to qualify for in the spring round. We also discussed the logo, which we will get to a little bit later in the agenda. And then otherwise, we planned and strategized around our events and our upcoming events and having a strong presence there, and also began strategizing for things that we'd like to see as we move into the summer and some summer events. Some feedback that we've gotten pretty often is that interactive events are really fun and folks like that. And so when we get to the hidden in plain sight, I'm excited to bolster that up a little bit, but also announce that we were able to purchase some of those impairment goggles. So y'all might be familiar. They're the goggles you put on that make you feel like you're under the use of substances. So we get to unveil those soon. I'm really excited about that and just being able to offer more engagement strategies and techniques in our events. So more to come on that. But want to open it up to other leadership team. I know Jamie, Elena, Jeanette, anything I missed or any additional comments?
No, nothing I can think of. Can I chime in?
Yeah. Oh, yes, of course, Keenan.
Yesterday, I attended, Vets on a Roll with Dennis at Island Creek. Boat launch was about 20 minutes from here. And participated, helped serve and talked to local veterans who were gathered. And I would say, 50 people roughly?
Yeah, from 50 to 60.
Yeah, lots and lots of folks, lots and lots of local veterans from across the area in North Carolina coming to celebrate, eat, and participate together. And I was sharing information about the coalition, about our services. So I thought it went really, really well. Dennis and I will be sharing additional information in the coming weeks so that more leadership team members as well as coalition members can participate as part of the outreach that Allison suggested.
Wonderful.
Dennis,
Did you catch anything?
Oh, I didn't fish. They invited me to fish, but you know, I can't stop talking and I'm very chatty.
They didn't want you on the boat.
No, I was telling Dennis, I've been on the lake for 50 years, but the fish don't have the patience for me, I'm sure.
We did have numbers of veterans catch fish.
Yeah.
To include, we had, for the first time ever, 2 blind participants. They both caught catfish and perch. They were thrilled to death. It was their first time fishing. So again, it is, anytime we ever get firsts, it's great. We also had a gentleman fish with us that has been fishing almost every time of this for over 15 years. So,
Wow.
you know, it is truly a veteran of the fishing trips of the rest. It's just amazing whenever we get these individuals here. And we did have young and old. In fact, we had a couple of younger vets that brought their mothers with them.
Oh. It's a wonderful event, a wonderful, wonderful event. It really speaks to your heart for why we do what we do. It really was. All right, other updates. So we're going to move on to the hidden in plain sight with Jamie. Share the screen. Hang on a second.
You want to share? Are you sharing the flyer, Keenan?
I'll share the flyer. I can share it.
So moving along, coming up this Sunday, Jamie has been working very, very hard to create this incredible event called Hidden in Plain Sight. Talk about interactive. It's going to be this Sunday from 3 to 5 at Bethany Baptist Church in Baskerville. And so Jamie, you want to come on and share a few words and talk about what you're planning?
The chat box.
Yeah.
I didn't see him.
Yeah,
I
no,
see his name. Jamie, can you hear us?
his microphone's not connected, unfortunately.
Okay.
See, it's not connected.
Okay. Will you share a little bit about it, Keenan?
Absolutely, absolutely. So as you all know, we gathered as a coalition many strategic partners for this event. Our plan for 2024 is to reach more people, more folks in 2024. So you can see that this Sunday afternoon with the Mecklenburg County Sheriff's Office with Sergeant Jamie King as their lead. It's going to be making a presentation called Hidden in Plain Sight. You can see it's Sunday from 3 to 5 p.m. I even saw a little tiny article in the newspaper yesterday, little tiny one. Somebody from Clarksville Baptist Church is advertising this and then sharing their phone number. They're loading buses of people from their church. Wow. And I was like, that's so cool. When somebody takes information that we've shared and they make their own, yes. Yeah, there you go. I didn't plan that. And so it was in the Mecklenburg Sun and I was like, oh my gosh, oh my gosh. So such cool. So Jamie is anticipating close to 100 people. We are gearing up to have information for 100+ people. So you can see there with, we've got the Trauma Informed Care Network folks coming. That's us as well. The Coalition, Southside Behavioral Health is sending some folks. Virginia Poison Control Center, Shelley will be there to talk. We're gonna have a lock and talk set up. We're gonna have a revive set up. We're gonna try to rapid revive, not 100 people. We can't do 100 people in 2 hours, but we're gonna rapid revive those that would like to be rapid revived and provide them with revive training in Narcan. So as Jamie would be telling you, there are gonna be tables around the church fellowship hall. We're gonna set tables up to represent all the different types of resources, folks that are coming to represent their resources around the room. And then after he does the first 45 minutes of talking about items, risky behaviors, et cetera, there's gonna be a bedroom set up, which as a coalition we funded along with him, have items on display that young people are using to hide the paraphernalia that they might not want their parents and caregivers and coaches and teachers to see. Once he does that presentation of the slideshow, the information about the state of our youth right now and the information we've got from various studies. There's going to be a breakout session so people can go around, do deeper dive conversations. You know, are you concerned about this or that, alcohol use, mental health wellness, get rapid revive trained, get a medication box. And then Jamie's going to invite everybody back together in the last half an hour and talk about the items hidden in plain sight. Did you see in the bedroom anything? Did you notice anything unusual in the bedroom display? So it's going to be fantastic. And I know Jamie would say, we hope that after this weekend, we're going to go ahead and start setting these up, maybe on a quarterly basis, every 6 months, not quite sure where we're looking to go, to other churches, schools, where can we go with this program? I hope I did that justice, Jamie. Put in the chat box anything you want me to add. So I hope you all plan to attend.
It's one of the coolest things we do. I think it's been 4 or 5 years since we've done one of these, and it was a really incredible thing to watch.
Yes, and this is going to be so much better, and that was fantastic that we did back in 2019. Yes.
I know that Dr. Huskin is interested in doing this at back to school for Halifax County. And we're going to help with it with the 4-H program. But the more people that are putting their fingers in this, I think the better that they, she definitely loves this program and wants the parents educated.
Wonderful.
I know my county wants to participate in Halifax County in some capacity. I think we try to talk to you about that.
Awesome. Yeah, we can start creating strategic, after this weekend, we can start coming up with a flyer, find a location, get the strategic partnerships on the flyer, Tri-County, 4-H, Halifax County Public Schools. That would be wonderful. That would be wonderful. Awesome.
Shannon, are you working with Fred on that at all? Or do you know if they're working with, Fred on that at all? Is he the contact?
I work directly with Dr. Huskin, with Amy.
Okay.
And she's right now we have Karen Tanner, and she has all the things to do, the hidden in plain sight, but you know, the more people that we can have helping with this, the better it is. And I would love to get more Southside into the school system.
Awesome.
Yeah, absolutely. We'd love to have this display set up inside the schools. Have to work on that. That would be wonderful. Any other questions about this event? I'll stop share. There are hard copies in the room. And then again, if you did not access the newsletter to get the flyer, you can email me. I'd be glad to send it to you directly.
All right. Jamie also put in the chat that he's a little busy at the moment, but if anybody has questions for him, just reach out.
Okay, well, I'll save it later. Awesome.
He's also meeting with the principal at the high school in the morning to discuss these events. Awesome, awesome. Thanks, Jamie.
Awesome. Hoping for a great turnout.
Mhm.
Mhm.
Everyone I've talked to is very excited about it, so great job, y'all.
Super stoked, super stoked. All right, I'll speak to the next item on the agenda, the lunch and learn. Please don't forget, it's not by community invitation, really only because we only have a room inside the high school that maxes to 50 people, so I didn't feel comfortable like with blasting it out to anybody and everybody. Not that that would be a good thing, but we're providing lunch at the Lunch and Learn. It's this coming Thursday at Mecklenburg High School. Let me share the flyer. People do need to RSVP for that, just so I make sure I have, obviously, at lunch. Hang on, let me see, where is it? It's up here. I know it is, it's underneath these little buttons, it won't go away sometimes. Come on. Not that one. Anybody know how to get into those buttons? Sometimes they won't go away. What is doing this to me?
Can you move it?
Oh, yeah, there we go. Maybe so.
I don't know.
Can I?
Sometimes you can.
I know.
Yeah,
Oh, there it is. God bless Catherine. All right, everybody see that? The Lunch and Learn this Thursday.
Mm-hmm.
Oh, it's tobacco
Right.
prevention.
Now, we do have, it's the culminating event of the Youth Tobacco Prevention Project we did with the Virginia Foundation for Healthy Youth. We do have students coming from all 4 of the school partnerships. So Southern Virginia Higher Education Center is bringing 6 to 8 young folks. The teachers that worked on the project, Mecklenburg is bringing 8, we'll have 8 to 10 there. Brunswick County is bringing 5 to 6 students and their staff. And Halifax High School is bringing closer to 15. So great turnout. Brenna will be talking to them about the importance of their impact. And I know that coalition members will be coming to talk to them about transferring some of their energy because this project does end in June. And so to have sustainability, we need to pick up with what else could these young folks be working on other than this particular project. It really just be a shift in what else would they be willing to work in connected to tobacco prevention, coalition work. We would have the funds to develop them a type of budget, YADAP ideas that we can develop about it. So if you haven't already RSVP'd and you want to come, just please let me know. I'm just tracking the numbers to make sure we have lunch in the 50-person room that they put us in. It's the multi-purpose room on the 2nd floor. Very nice room. Very nice room.
Keenan, we have a request in the chat to send the flyer to Miss Lewis.
Oh, absolutely. And you talking about the Hidden in Plains flyer or the one that's currently up? Or I'll send her all the flyers. That's my go-to.
You get a flyer, and you get a flyer.
When somebody emails me and says, "Can I sign up for your training?" I respond and go, "I'm not sure which one. Here they all. Let me know which one you want to be in." That's the best. That's the best email. Yes, because we're doing all such wonderful, great work. I just always assume you want to be in everything. All right, and my chat is messed up. I'll fix it later. All right. Liam, back to you on May 8th.
Okay. Next up on the agenda is just remember the Pathways to Resilience Conference is coming up in Danville at the Higher Learning Institute on May 8th. I think we might have some outdated information. I think registration has officially closed for that, but hopefully the folks who wanted to go were able. We're really excited to be able to sponsor this event. Danville, Pennsylvania Community Services Board is really a great partner in the resilience sector and just, have been doing this for quite a while. So it's exciting to get to expand our partnership with them a bit and also just get some awareness and, share a little bit about what we're doing too. And so a number of us will be tabling at that event. I know Christine is going to be there. Christine Pennington is going to be there representing TARP as well. So I hope, I think it's gearing up to be a wonderful event. I think registration closed at close to 200 people. Am I remembering that correctly? Yeah.
Yes, it did. They had to
So-
close it down early to max out the facility. So that is wonderful, wonderful.
Yeah. So very excited for them and for us. Any questions on that? All right, hearing no questions, Elena, I'm gonna turn it over to you to give us an update on the continuum of care, please.
Okay, so I just wanna, I think I've already told y'all this, but I wanted to go back over again. We did our point in time count on January 24th. On that night in Mecklenburg, Halifax, and Brunswick County, and Charlotte County, we found 12 households comprising 15 individuals who were found to be homeless. 2 of these households included children. We found 19 households, 41 individuals who were identified as sheltered. That means they were residing in emergency shelter or in transitional housing. And then we found 14 households with 37 individuals who reported to be staying with family or friends, residing in motel at personal expense, or occupying dwellings deemed unfit for human habitation. As we talked about before, homelessness in Southside does not look like urban homelessness. We don't often see the people who are experiencing homelessness, but we do know that they're there. We did also at our last meeting last week talk about how we would like to open our own homeless shelter in the area if at all possible. It would be significantly cheaper than hotel vouchers, which is what we do now and do not have enough funding for. So if anyone has any ideas, we're looking for hopefully a 3 to 4 bedroom type house. It can be a fixer-upper. If someone just didn't want that house anymore and wanted to donate it, we would definitely love that, but we understand that's not likely. But we can't house or offer emergency shelter to nearly the people that need it. And we're hoping that a homeless shelter, a static location, would allow us to help more of the people who need help when they need it.
Are you looking what county, what
Mecklenburg
location?
and Halifax mostly,
Okay.
that's where the need is greatest. And also it's easier for people to get there. We're also, obviously, we would need some sort of transportation program. If someone called from Charlotte Courthouse and we say, well, you can come to Halifax if you can get here. That's
If
not.
they're homeless, they're most
Exactly.
likely
Exactly.
Yes.
driveless in a lot of cases.
And that's often an issue.
Yeah.
Are y'all a 501c3 so that we can,
Yes.
as we advertise, it's always important that you're a 501c3 because you can advertise that they can donate the house or whatever.
Yes,
Mhm.
we would.
Yeah, continuum of care is under Tri-County, so, yeah.
And that's all that I have.
And we are.
Oh, thank you, thank you.
Thank you, Elena. And just so y'all know, our continuum of care in the South Side is under a larger state group called the Balance of State Local Planning Group. So we are Southside Planning Group 13, and they do all of the congregate data throughout the Balance of State. So it's all the rural regions of Virginia, Southwest and super East Coast included. And amongst the rise and increase in homelessness in the state, our region was one of the higher ones. And it was specifically noted that it's due to the lack of access to resources, lack of not just affordable, but housing that meets HUD's living standards, essentially. I can never say that word. But so, we not only, I think we and I think the Eastern Shore Board are very unique in our challenges, also reside in that the housing we do have would not meet HUD standards. And so, we need pretty significant rehabilitation or development efforts in our region as well. So just wanted to throw that out there so folks know that an emergency shelter is absolutely needed. But, we need to support the COC and think about long-term stability and helping our community regain stability in that way. So just throwing that out there.
Thank you.
Yeah. Not that I have a particular bias towards homelessness or anything. Okay, so I'll go ahead and pull the agenda back up. Update from Sakova. Stephen, I know you were there. I went to the summit planning meeting as well. From my understanding, most of the meeting consisted of summit planning and discussions around what that would look like. But Stephen, want to give you some space if you had any additional comments.
Yes, just that, I believe I touched on it last month, but, because of the length of the drive, I think there was a lot of feedback that a one-day summit just wasn't worth the drive, for people that were up to 5 hours away, I guess. And, so what they're doing is the 20th, as they've done in other ones, they'll have evening networking at a local restaurant. That's Sunday. Monday, the 21st, there will be a full day of sessions and a half day of sessions again on the 22nd. Outside of that, they're still looking for volunteers for planning, and as you said, they just had a planning session on the 16th, a couple days ago. There was some talk early in the meeting. One thing to be on the lookout in our market is tianeptine. It's being called gas station heroin. It's basically being sold as a dietary supplement. But what it has is opioid agonist effects. Look for that in containers. It's tianeptine, but it's sold under several different brand names. It's in a container about the size of a 5-hour energy. So look for those in our area. If you see them, we may need to look at that and see what if any laws in Virginia might pertain to the sale of it. That's all I got.
Okay. All right.
Great, thank you.
And then Liam, you'll tell me about registration. I think registration opens in the next week or so. We do need to move forward with going ahead, even though it is in October. I do need to move ahead asking for funding to get folks registered, how many you want to go, who's going, that type of thing.
Okay. I'm gonna put a nod to my leadership team, folks. Please hold those dates on your calendar and we can discuss and finalize numbers in the next week or so.
Okay, all right.
I'm a definite yes, Keenan.
Okay. Right. And then the logo.
Oh, and one other thing I forgot to share about Sakova is I did get the official notice that Southside Behavioral Health Lean-In Project and Danville, Pennsylvania Community Services Board have been green-lighted for a session on our We Stand Together Summit and our planning around that. And so we will actually be presenting a session at the summit.
Nice.
Oh, that's awesome. That's awesome.
Very good.
I hadn't heard that. That's awesome.
Yeah, Travis shared it Tuesday.
Oh, sweet.
It was in a spreadsheet that Travis shared Tuesday, more specifically.
Oh, sweet. Good to see. Okay. That's awesome. That's awesome.
So,
all right.
yeah,
So we need to
and
yeah, that's awesome.
it's not on the agenda, but shout out to Keenan also, who was asked to present at the upcoming Prevention Summit in Norfolk about the We Stand Together conference. So it's getting out there, y'all.
Yep. Oh, look what Shelly said, because my chat's messed up. You said it went away.
Okay, I was recently at an event with someone from the Attorney General's office, and they spoke on how the Virginia Board of Pharmacy had issued an emergency order on January 31st, 2024, adding a substance Scheduled 1 controlled substance. As of February 28th, 2024, gas station heroin is a Scheduled 1 controlled substance in Virginia and can be seized and prosecuted. However, the rollout of this is a little slow since it is coming from the Board of Pharmacy and not through the General Assembly. Oh, good information, Sherry. Thank you, Shelley. Thank you for sharing that.
All right, I'm right on Shelly chat, add notes. All right, Stephen. Okay.
Keenan, do you need me to screenshot the chat at the end of the meeting so you can have it?
Oh, no, something's wrong with my chat. It's for some reason it's coming up super large.
Oh, okay.
Might be just as You'll see that? Only the folks in the room get a chuckle out of that. I bring my chat up and it blows up in like one letter. It's just, my Zoom's just having a good time with me, that's all.
Well, nobody said Keenan any sneaky messages. So,
Steven is stretching my IT skills, which have gotten quite good since 2019. He's
I won't say there hasn't been improvement.
No, there's been vast improvement, I'll say that. No, I know, something happens, I'm sure it's my Zoom. I'll be able to download it, it'll be fine when I download it.
okay, all right, cool.
Okay.
All right, so the next item on our agenda is we opened up a survey, I believe on April 2nd. We didn't send it out April 1st because we didn't want folks to think it was an April Fool's joke. But we are working on rebranding and doing, you know, the big part of that is getting a new logo. So Sarah, who is the marketing person for Southside Behavioral Health, did an excellent job and put together 2 logos for us. I apologize, I don't have the edited version of one of them, but can y'all see that?
And
Okay, so this was one of the logos that went out for voting. The only edit that we made to this one is we removed one of the little people figures, just so it would be more representative of the 3 counties. And then the second logo that went out was this one. And oh, it's loading. Okay, there we go. And the changes we requested for this one are we put the counties above, or we put Southside Wellness Coalition above the little gray swishy, and then underneath we put the 3 counties that we represent. And so those did go out in a Survey Monkey link. It is closing tomorrow on the 19th. We do have an overwhelming majority of votes leaning one way. And so I feel pretty confident in saying that new logo coming at you very soon. And so we'll be excited to share the final version of that at our next meeting. But thank you to everyone who took the time to vote. Just a reminder, voting is still open. That link was in the newsletter. It also came out in a blast. So if you haven't gotten it, let us know. We'll get it over to you so that you can voice it. You're also welcome to reach out to Keenan or myself. If the link for whatever reason isn't working for you and you want to give us your vote, we'll record it that way too. But thank you all so much for your participation in that.
definitely, and the second logo you shared wasn't complete, but the complete logo was shared in that link.
Right. Okay, so at this time, I'm going to open it up to member news, and specifically, I'm going to turn it over to Shannon, who requested to share who shared some information with us today.
Do you have that flyer that you can put in the chat maybe?
Yes, I will put it in the chat.
Super. I bring news from Crossroads, which is Empowering Piedmont Coalition. We met yesterday. We are having an event that we wanted to cross promote with you all that is going to be up at Shea Park in Blackstone, May 4th. It is it's a Children's Mental Health Awareness Day. I'm looking at this. We have family fun, bounce houses, mini golf, face painting, popcorn, games, and parent resources. So my group COPE is going to have a table there, as well as the Prince Edward and Halifax opioid studies that we're doing, Liam, by the way. And there's a free meal for the first 150 people that come. They are looking for anybody else that would love to come and have a table so that there's more representation of groups. So if anybody is kind of in that area and move and has a little bit of a northern edge, that you are more than welcome to get in contact with me, and I'll get you with the right people. But that is going to be going on. And then let's see what else. I'm also going to be going to the National Health Outreach Conference, May 13th to the 15th, down in, it's co-hosted by the University of Georgia and Clemson, and our group, COPE, has been invited to speak and talk about what we are doing for education for opioid prevention, which is very exciting. That I've never spoken to that many people in my life, but I guess I'm gonna start now.
So I believe in you. You got
Oh,
it.
the other thing that, if anybody has more contacts, that we are now also, that I'm able to reach out, as well as we have, of course, mental health first aid, which we have been doing. We have the Botvin Life Skills Program, but we have also been able to, be turned loose with giving Owls Pals. I have already got it with the Tri-County. If there are any other groups that need the Owls Pals, which is a puppet-based, evidence-based program for pre-K and kindergarten, that I've got the funding now to provide that, or to have teachers who are not currently trained in it. We did an event last year and got puppets and training for the Tri-County people in this area. But if anybody else wants it, needs it, that I'm going to be putting together, it's done like 30 people and 30 kits at a time. So I'm going to be bringing people together from different Tri-County agent or different Head Start organizations to get the people trained and get the kits to the instructors that have not yet had it or need new ones because they're so well used. So that Owls Pals program is something, give me a shout about it if you have any need for it in your area.
And what grades did you say that was again?
The Owls Pals specifically is pre-K and kindergarten. And then we have elementary, middle, and high with the Botvin Life Skills Program. They also have a new program called Transitions, which is for seniors in high school that are getting ready to graduate. That is standalone, and I think it's a fairly it's a foreshortened thing. So any of those are available, and of course the parent program. Any of those are available at no cost to school systems or church groups or anyone that wants to be doing them.
Okay, and can I ask you real quick, who's your funding, you think, from Virginia Tech?
My funding through Virginia Tech is now the Opioid Authority. That the Virginia Opioid Authority we have changed our funding, so we are not restricted to rural areas anymore. That we can go anywhere that someone needs our assistance.
Okay. All right, I got them. Oh, and I shared what was dropped in the chat. Y'all see it?
Yes.
Thank you very much.
She's proud.
I did something on the fly.
Thank you, Shannon.
Thank you.
So we just want to open it up to the general floor, folks online as well. Any updates, events y'all have going on that you want us to know about or share?
I have to apologize to everybody. I just received note from the VAs that Juneteenth is a federal holiday, so therefore the VAs will not have it that day. But they are rescheduling right now. They tell us what days they want to go on the lake.
Okay.
So as soon as they decide, then we will pass the word back out.
Okay.
Great. Thank you, Dennis.
All right.
This is Catherine. Tri-County is putting on an event in Halifax County in Constitution Square in South Boston on June 8th. It's called Rock the Block. It's free to anybody. There's food, very similar to what was just put up. And it's for residents of Halifax County. And face painting, all the games, all the fun. So that'll be on June 8th. So pass the word. I will try and get you a flyer, Keenan, so that we can get it out to everybody. But
Yeah, see if we can get, I would love to have that too, and debate, and if you need it, so, more people at tables, that I would love to come.
oh yeah, that'd be great.
June 8th.
Who was that?
That was Shannon.
That was Shannon? Okay.
June 8th. You said you want to send a flyer?
Yep, I'll send the flyer.
Thank you.
Add in.
I'll give it to Keenan.
My head is not here with the YMCA. The YMCA is also hosting an event tomorrow in Chase City.
it's their annual, they do it for kids, it's a
Right,
free
help-
event.
Right,
They'll
healthy
have
kids.
like instructors there, they'll play games, they might do Zumba, they might do some yoga, so it's right there. If you know where the Estes Center is in Chase City, it's right there. And it's their yearly event that they do to get kids involved and out and playing hopscotch and, hula hoop, whatever, just so to get them involved in a healthy lifestyle. And there's free food and free events and goodies.
Good, thank you for sharing that.
You're welcome.
I
What-
did not.
What day is that gonna be?
This Saturday.
This
10 to-
Saturday, okay.
This Saturday, April 20th, from 10 to 2 in Chase City at their YMCA.
And then Tri-County Domestic Violence Program is hosting a Rainbow Tea next Saturday, April 27th, from 12 to 2 at the Washington Coleman Community Center, and they are taking donations for that. You can reach out to the Tri-County or Emergency Services Satellite Office if you'd like to participate in that.
And we made a donation of a coalition cake to that.
Awesome. I wondered why you were bringing down a cake.
A coalition cake. Love it.
Coalition cake. You said that's April 27th?
Yes.
At the
12 to
Washington
2.
Coleman Center?
Yeah, at Washington Coleman.
Rainbow Tea, is that open to anybody?
Yep.
Is there a flyer you can send me?
Yep.
All right, awesome. All right, lots of great member information. All right.
I have a couple of things, if I may.
Yes,
Yes,
please,
Ms. Grimes.
Jeanette.
All right, Brunswick County, there is a community day being held on June 1st at the local middle school. I didn't get a flyer yet, but I have been asked to put that on the calendar. I'll share that when I get it. And in Brunswick County, the second Saturday in June, June 8th, they're going to celebrate Juneteenth. It was really a great turnout last year. And if you're familiar, the remote area clinic is going to happen again in Emporia, Virginia, for all the surrounding counties in Greensville High School. And it's free, and it's June 22nd and 23rd, Saturday and Sunday. If you know anyone that needs vision, dental, or medical help, that they can free to come. And that's going to be all day long. People start lining up at 3 or 4 o'clock in the morning until
wow.
about 6 p.m. And we served, I believe, over 500 last year. So if you need it, but when I get those updated flyers, I'll forward them out. Thank you.
Awesome, thank you.
Thank
And that's
you.
the RA, it's RAB, right? RAB clinic? Is that the-
RAM, Remote Area Medical.
Okay, I knew there was an acronym for that. Okay,
Yeah, RAM.
that's RAM. Okay,
RAM.
all right, cool. All right, awesome. Okay, other updates?
Something that I wanted to mention, just to all you out there, VCU, for those of you who may not be aware, has been charged with the state to do studies on how to, spend the opioid abatement money that Virginia is getting. And so in our area, Mecklenburg, Halifax, and Brunswick, they are looking for people to be involved, to, complete surveys and things like that, so that they can find out what the needs are in those 3 counties. And based on the outcome of the study, my understanding is this is going to determine how much money comes our way for each of the counties and what that money is going to go towards. So really, they're looking for service agencies, professionals, residents, like anybody that they can who can be a voice and commit some time, a couple hours a month to this study. So I think it's in all of our best interest to try to be involved. So if there's anybody who would like to be involved, please email me your information and I will pass it on to the folks at VCU.
Darren, actually, Virginia Tech has studies going in Halifax, Mecklenburg, and Brunswick on that exact topic.
I'm sorry, Virginia Tech is what I meant to say, not
Okay.
VCU. I apologize.
Okay,
Yeah, so we are working with the Virginia Tech folks.
Yes.
This was a great opportunity to touch a lot of folks out there and just sort of spread the word that they are looking to try to get more participants in that survey. So I can hand off the information, any of your contact information to the folks at Virginia Tech,
okay.
and they can reach out to you about being involved.
Yeah, and specifically our study in Halifax, we are like 2 or 3 people away from being able to finish up our topic groups. So if there's anybody that would like to join us, that we're so close to being able to really get rolling. So I know that they came and spoke about it at the last meeting, Liam.
Mhm.
Yeah. So, and we've had some really good turnout. We appreciate that too.
And I actually sent a list of participants to Dominique yesterday because we was on a call with them. They asked us to the community health workers to pitch in and see if we could get some participants. So I emailed her a list of participants yesterday.
Thank you.
Yeah. I've been specifically trying to drum up participants for Brunswick County. That was the group that I was asked to be a part of. So I've been working on that specifically, but I know that they've been looking for all 3 counties.
Yeah, mine was for Mecklenburg
Yeah.
County.
Okay. Who's the person that you all are emailing? I missed that. They're sending the contact information for these new folks adding in.
Well, I mean, you can send it to Dominique, or there's hang on a second. What's that?
Was it Sarah Cott?
Sarah actually has left.
Yeah.
Sarah got promoted out of the universe.
Oh, okay.
So,
I think the other lady was named
yeah,
Sophie.
if it gets to Liam, if it gets to me, any of us, we can pass it along to the right people.
Okay, okay.
I can also, I mean, if you're interested, I mean, I can also find their email address. Hang on a second here. And I mean, I can drop that into the chat area.
I just put mine in case anybody needs it.
Dominique is who's been sending my surveys.
Okay, what's the last name on that?
Alani.
Okay, that's a new name to me. That's why I was trying to make sure I was getting everything in the minutes.
Yeah, I have Sophie and Dominique's on the information that they sent out.
Yes.
Yeah.
Yeah.
Those are the
Okay.
those are the 2 people contact since Sarah's out.
Okay. All right.
So let me get this straight. Is that creating is this a team now covers all 3 of the counties for my minutes?
Mine is how.
They're different. They're doing different studies. We're doing a seed study in Halifax, and I can't remember the name of the other one. Liam, can you help me that they're doing? Okay, they're doing one in Prince Edward, Mecklenburg, and Brunswick.
Yeah. I received 2 separate emails, the one about engaging Mecklenburg and the one about engaging Brunswick.
Okay.
And it as if it's just a little change, but you know what? I'll look for them and forward them to you, Keena.
Yeah, Jeanette, can you, so in the minutes, I want to be able to say, if someone is from Halifax, this is the contact. If someone's from Mecklenburg, this is the contact.
But they're the Halifax contact.
Yeah.
I am the Halifax. And like I said, I'm more than happy if there's anybody from Mecklenburg or for Brunswick, that I will get them to the powers that be. That's part of what I do, is that I work with Dominique and Sophie, and I'm more than happy to help with that.
And if there's anybody out there that has inroads into anyone in the Board of Education or the education system in Brunswick, I have left multiple messages. I left it with the superintendent. I left it with the high school principal. Nobody has responded to this, and they really are desperate to get somebody from the education system on that study.
I'll see, can I get, I'll go up to the high school, give me till next week. But I'll be able to go up there and talk to someone directly because we're doing another project with some of the youth here. So I'll see,
Okay.
can I get someone from Brunswick?
That would be
you.
fantastic.
Thank you, Jeanette.
Yep.
Jeanette connecting into Brunswick. All right, awesome. Any other member updates? All right, Liam, back to you.
All right, well, folks, last couple of notes for y'all, just real quick. Upcoming, oh, I can share my screen real quick. I realized I wasn't doing that. I'm so sorry. Upcoming on our training side, we have a virtual revive coming on May 6th and June 10th. All of them are at 4 p.m. Make sure to email prevention at Southside if you want to be included in that. We also have an assist class coming up on April 24th and 25th. That's going to be in South Boston. Also email prevention at Southside if you're interested in coming to that or want to distribute that information out. And then just a reminder, our next meeting is going to be another hybrid meeting on May 23rd. Again, as always, beginning at 10 a.m. Just shouting out, y'all do some great work. I know we have some folks to connect with in the chat. And so, you know, if you ever want to come on and present about the work you're doing or any impacts we can help, you know, let us know. We love to have you. We love to spotlight you and we love what you do. You know, otherwise, just make sure you check us out on social media. We post pretty regularly and try to keep everything up to date. As always, you can access anything you need to in our document hub on Be Well Southside. And otherwise, I think that's all I have for you all today. Thank you so much for your time and your attention and just the work you do. I look forward to seeing y'all in May.
All right, meeting adjourned.
Thanks,
11.
Liam.
Thank you all.
Thank you, everybody. Bye-bye.
Bye. Thank you, Ms. Grimes.
Great meeting.
We have done this in the past, not
Oh.
here, but we haven't done it. Contact FEMA. The FEMA homes are federally approved. They bring them in for disasters and other stuff, and we've used them